Persons with mild forms of the COVID-19 virus will no longer isolate at home. They will instead be placed at repurposed hotel sites effective immediately. The Health Ministry sought to explain the reason behind the change in the model of care. Public health officials say the decision was based on the growing number of cases and protocol breaches.
In undertaking routine reviews of the national plan to manage the COVID-19 outbreak, which includes the treatment and care component, the Ministry of Health recognizes the need to adjust this model of care. There has recently been a large number of persons being managed in community. This, combined with the inadequacy of the homes to give the required isolation as well as breaches, has resulted in changes to the care of our confirmed cases. Home isolation is now being transitioned to state-based isolation facilities. Effective immediately, this change now means that mild cases are being placed within hotel sites, and the moderate to severe cases continue to be cared for within the National Respiratory Hospital.
Chief Medical Officer Dr. Sharon Belmar-George says the move to hotel sites will ensure that COVID-19 patients are cared for more effectively.
This allows for a greater degree of vigilance in the management of the milder COVID-19 cases, given home isolation cannot be effectively conducted for some individuals who are in care. These changes have been made primarily to protect the health and safety of all, not only people diagnosed with the virus. It is expected that this new model will support the efforts to contain the virus and will allow for more focused care being delivered to all our patients as their period of infection is being managed.
Dr. George states that the ministry decided to shift to home isolation as more than half of the patients diagnosed with the virus exhibited little to no symptoms.
The Ministry of Health and Wellness continues our focused efforts to manage the current surge in COVID-19 cases being diagnosed in St. Lucia. The ministry has used a mixed model of care. This has allowed for the management of mild cases to take place within communities. They have been monitored by a dedicated medical team overseeing cases being managed at home. This approach has been taken given that approximately 80% of people diagnosed with the virus experience fairly mild disease. As a result, a large number of our cases remain at home to isolate and receive care until they recover.
As of the filing of this news report, there were 712 active COVID-19 cases with 3 patients listed in critical condition. Joachim Duplessis, HTS News Force.